السلام عليكم. أنا تدريسية دكتورة زينب حيدر الكفيشي، تدريسية في جامعة بابل كلية الطب فرع الأمراض والطب العدلي. محاضرتنا اليوم هي Cellular adaptation and injury. عادة تكون هاي المحاضرة موجهة إلى طلاب المرحلة الثالثة في كلية الطب. Objectives at the end of our lectures, the people should differentiate between and understand the concepts of cellular growth, adaptation, hyperplasia, hypertrophy, atrophy, metaplasia. We should list the factors of cell injury, death, and describe the pathological mechanisms at the subcellular levels, compare and differentiate concepts of apoptosis and necrosis, identify common intracellular accumulation and understand the aging and differentiate the concepts of programmed cell death. At first, we should know the cellular response to harmful stimuli, which is the basic of our lecture today. You know, the cells have different organelles and each cells in our body have carry specific functions, depends on machinery and pathological pathway. The cells are continuously adjacent to their structures and function within the narrow range to deal with the continually changing extracellular environment. This ability on the part of the cell to maintain dynamic stable state referred to homeostasis. If the cells encounter more severe external change, either physiological or pathological, it will undergo specific changes. These changes are referred to adaptations. The morphological and functional changes include induced by injury may be reversibles and may be irreversibles. So cellular adaptations are reversible changes and are divided into physiological and pathological adaptations. Physiological adaptation usually represent the response of the cells to normal stimulation, hormonal induced enlargement of the breast and the uterus during pregnancy as examples. Whether the pathological adaptations, on the other hand, can take into several distinct forms. So, types of adaptations, we have mainly four types of adaptation. First of them is the hypertrophy. Hypertrophy refers to increase the size of the cells that result in the enlargement of the entire organ. Hypertrophy can either be physiological or pathological and is caused by increased functional demand or by specific hormonal stimulation. Examples of physiological hypertrophy is that induced that the skeletal muscles of the athletes and the mechanical workers and the enlargement of the uterus during the pregnancy. This is how the physiological hypertrophy. This is the physiological hypertrophy of the gravid uterus during pregnancy. Whether the pathological hypertrophy exemplified by cardiomegaly, secondary to hypertension. The stimulation here is the increase the hypertension, which lead in increased size of the cardiac muscles. This is the examples of the pathological hypertrophy in the cardiac muscles due to hypertrophy. The second type of adaptation is hyperplasia. Here, hyperplasia is the increased size, Hypertrophy increases the size, while hyperplasia increases the numbers of the cells. It takes place only if the cells are capable of replication, of course. So it may occur with hypertrophy and often responds to same stimuli. As in hypertrophy, hyperplasia can be physiological or pathological. Physiological hyperplasia refer to two types, either due to hormonal hyperplasia or compensatory hyperplasia. In hormonal, exemplified proliferation of the glandular epithelium of the female breast at puberty. While the compensatory hyperplasia occur when proportion of the tissue is removed or disease, for example, when the liver partially resected, and it is the basic of liver donation. Pathological hyperplasia, usually excessive hormonal or growth factor stimulation. Here's the example is endometrial hyperplasia or the skin wart. This is the skin wart. Third type of adaptation is the atrophy. Atrophy here refers to shrinkage of the size of the cells due to loss of the constituent substance. This situation is exactly opposite to hypertrophy. When the sufficient number of the cells are involved, the entire tissue or organ diminished in size, so become atrophic. Causes of atrophy, many causes include decrease in workload, denervation of a limb, diminished blood supply, inadequate nutrition as in starvation, loss of endocrine stimulation as in postmenopausal endometrial atrophy, and finally the aging, which is known as senile atrophy. Here examples of atrophy, we notice here that the size of the muscles decrease. Although some of these stimuli are physiological, loss of hormone stimulation and menopausal, and other pathological, the fundamental cellular changes in atrophy is identical and the same. It should present retreated by the cells to a smaller size, which is survival still possible. So a new equilibrium is achieved between the cell size, diminished blood supply, nutrition, or trophic stimulation. Atrophy results from decreased protein synthesis together with increased protein degradation. The final types of adaptation is the metaplasia. Metaplasia here refer to a reversible change in which there is the placement of normal mature epithelium at a given site by another mature benign epithelium inappropriate to the site. So it is change in the cell type, but both of them are mature, so we should differentiate it from dysplasia. This cellular adaptation cells sensitive to a particular stress are replaced by other types of more capable of resisting and the adverse environment. Metaplasia is to arise by genetic reprogramming of the stem cells. The epithelial metaplasia is exemplified by the squamous changes that occur in the respiratory epithelium of the habitual cigarette smoking. The normal slated columnar epithelium of the trachea and bronchi are focally or extensively replaced by stratified squamous epithelium, which is more resistant to the external environment effect, which is the smoking here. So here we see in the metaplasia, the normal slated columnar epithelium are suddenly replaced to a squamous epithelium, as we see here. Although the metaplastic squamous epithelium is more resistant to the injurious environment, it has the adverse effect that include, first, loss of the protective mechanism, such as the mucus secretions and ciliary clearance of the particles, which is normally present in the trachea. Second, predisposition to malignancy. In fact, squamous cell carcinoma of the bronchi often coexists with squamous metaplasia. Squamous metaplasia is also seen in the urinary bladder harboring schistosomal ovum. And when there is persistent regurgitation of the gastric content into the esophagus, chronic gastroesophageal reflex disease, the normal stratified squamous epithelium of the lower esophagus may be replaced by metaplastic intestinal type columnar epithelium. The latter is more resistant to the highly acidic regurgitation gastric content. Now we finish the adaptation. The four types of adaptation, the cells, usually it is reversible. The cells can cooperate and avoid the cell injury. But if the cell injury or injurious agents is still present and beyond the capability of the cells, so adaptation, cell injury will occur. So cell injury results when the cells are exposed to persistent stress, so that the affected cells are no longer able to adapt, or inherently damaging agents, or damaging. A reversible cell injury can be reversible or irreversible. A reversible cell injury occurs when the injurious agent is mild but persistent, or severe but short-lived. In these types of the injury, the functional and morphological changes are reversible. With continuing damaging, if the damaging agent still present, there is irreversible injury, at which time the cells cannot recover even with the removal of the injurious agent, so it is died. Here we see that the normal cells in hemostasis condition If undergo to stress or injurious stimulation, the stress can lead to adaptation. If the adaptation is increased, inability to adapt, or the injurious agent is from the beginning is harmful, the cell will undergo cell injury. If the cell injury is mild and transient, the cell will be a reversible injury and can back to the normal status of homeostasis. But if the injurious agent persists and severe progressive, this injury will lead to irreversible injury. And there's two types of cell death, which is necrosis and apoptosis, and we will talk about it in our next lectures. We have many causes of cell injury, which we will shortly list them. First of all, hypoxia, which is oxygen deprivation. It is the main on the common causes of injury. Second, we have chemical agents, various poisons on the environmental toxins. Third, infectious agent, including viruses, bacteria, rickettsia, fungi, and parasites. For immunological actions, they are primarily defensive in nature, but can also result in the cell and tissue injury, which is the examples are autoimmune and allergic reactions. Genetic defects include gross congenital malformation, nutritional imbalance, physical agent, and finally aging. This is our lecture, the final our lecture. In our next lecture, we'll talk about the apoptosis and necrosis and the effect of the injurious agents. I hope that my lectures is clear to you, and see you next in our next lectures. Thank you.